So, Paul, you've heard of Isaac Newton. He was pretty well known in his time.
Pretty
That,
well-known guy.
that
Yeah.
Isaac Newton guy.
Yeah.
His third law of motion states, Newton's third law of motion, for every action, there is an equal and opposite reaction. I'm sure you've heard that before, right?
Yes.
So he not only said that, he lived it. He suffered a couple of nervous breakdowns during his life, Isaac Newton did, and those were caused in part, historians believe, from his sleep disorders. He had insomnia and other problems, and he also, he was probably nervous about apples falling on his head and everything else. So he had those things to worry about, and many Americans and others around the world have the same issues, and it's one of the things we're going to talk about this morning on Health Matters with Paul Rosen.
It is one of the things. We're also going to add hot flashes. And
you had me worried there for a second. I thought, oh no, I totally botched that. But okay, that pause was just for dramatic effect, I'm sure.
Indeed. And, a little drama goes a long, long way. You know what I'm saying?
It does, matter of fact.
So hot flashes, night sweats, and insomnia. No, you don't have a disease, ladies. And conventional therapies like HRT put you at greater risk for cancer and strokes. We're going to talk about a safer approach. With that, let me take you through a little bit of the very, very, very briefly, the history of hormone replacement therapy. And it began some time ago, back in the 1930s, actually, with the discovery of synthetic estrogen. And the theory, and it still prevails for the most part today, of premenstrual or postmenopausal symptoms is that there's this imbalance of estrogen and progesterone going on, and that's why you have these symptoms. This is a highly simplistic view, and we've had plenty of time and plenty of studies done to show that hormone replacement therapy may or may not relieve one or more of these symptoms. But in my experience as a clinician, I've never seen such a strategy relieve the individual of all of the symptoms. Certainly not all of the symptoms completely. And what that tells me as a clinician is it tells me that although this may be useful in some instances, it simply isn't addressing the root cause of the problem.
Is HRT, Paul, a surgical procedure? Is it
No. It's a chemical procedure. It's introducing synthetic hormones into the system
to try to achieve some kind of balance in the system to relieve these symptoms women may be suffering.
That's the theory, yeah.
Okay, that's the theory. But as you're explaining, that may not work out as well as we may hope.
Well, in my experience, it definitely doesn't work out as well as we'd hope. And furthermore, we add risks of heart disease and stroke, and maybe cancer in some people, with the chronic use of such synthetic chemicals. And the use of non-synthetic or herbal may not accelerate such risks, but they also don't really resolve the issue for most people, and they add their own level of complication to it.
So what I'm hearing from
having said all this, there are at least one or two categories of individuals who are going to be stuck with hormone replacement therapy. And those are people who have had their endocrine glands removed surgically, either for whatever reason, whether they be cancerous or any other reason. If you remove your thyroid, or you remove your ovaries, or you remove an adrenal gland, or whatever it happens to be, then chemical intervention is what you've got. So, but even having said that, the work that I do, utilizing the supplements and tools that I have, will still improve the quality of your life, because hormone replacement therapy simply doesn't and will never be able to treat the root cause of these particular symptoms: the hot sweats, uh, the hot flashes, the night sweats, and insomnia.
So, despite all that, Paul, does HRT remain a popular treatment? Are people still doing it? Whether
It's
they
the most popular.
okay,
Yeah, it's
so
the most popular, and unfortunately, um, you know, like so many things that we do, it becomes part of the culture, and it's very difficult for even doctors who recognize that this particular approach may not be the panacea, but their hands are tied because now it's um, uh, basically the standard of care, and so they're stuck. But the thing is you who are listening are not stuck. You can reach out and utilize an alternative, and the alternative is finding out the root cause of why, and I'm going to be very specific here. In the case of insomnia, why your thyroid is not happy. You can't have insomnia without having thyroid problems, and I don't care what your blood tests reveal.
so in some
Or hot flashes means your bladder, your urinary bladder is upset for one reason or another, and you cannot have hot flashes or hot flushes without having a bladder issue, regardless of what blood tests or any other medical tests might say about the situation. And finally, night sweats. There's always a complication, a heart complication with night sweats. So the root cause would be to find out why your thyroid, why your bladder, and or why your heart is not energetically happy, why it isn't jumping up and down for joy.
So each of those three symptoms you've described relates to an issue with a particular organ. We can summarize
Or
safely
gland.
by organ or gland. We can safely say that. So I guess the solution, if we can call it that, is to strengthen the health of those particular organs or glands. Am I on the right track?
You are. And as always, and I cannot ever get tired of saying this, in order to have a highly effective nutritional strategy, you've got to address two wings of the bird. In other words, a bird does not fly with one wing. Have you ever seen that, Rod?
No, I would be very
No,
impressed if
that's
a
right.
bird could pull that off.
So, same thing with a nutritional strategy or program. You've got to address the two wings of the bird. One of them being the nutritional aspects, making sure that nutritional deficiencies are supplemented properly. That's what you're referring to. And the second is the environment. If you're not addressing the environmental impingements or obstructions, then you're a bird with one wing.
So you can't do one without the other and expect to become as healthy as you should be.
Or experience complete relief of the symptoms, ultimately treating the root cause. No,
So
absolutely not.
can you be so specific as to identify certain nutritional steps that must be taken to address that patient's issues?
Well, that's where the testing comes in. That's why you've got to come to see somebody like me, because you've got to find out what the uniquenesses of your particular body happens to be. I mean, this is something that I discovered many years ago when my health went south dramatically, and nobody could figure out, could unlock the combination and resolve my issues, right? Because there wasn't anybody who was actually taking into consideration the uniquenesses of my condition, and furthermore, they didn't understand the bird. What's the word I want?
The
The bird
birdonology.
analogy.
There you go.
Yeah, the bird analogy. So you've got to have both wings of the bird addressed. And the only way to do that is to be evaluated by somebody who understands those concepts intimately. I mean, I wish I could say, yeah, just go to your local store and pick up vitamin D and you're fine. And the truth of the matter is, that's what most people are. That's as far as most people are willing to go, with their own health. But if you're experiencing hot flashes, night sweats, and insomnia, or any other type of a symptom, and you're concerned about taking medications for the rest of your life, then you have to really start taking responsibility, and you've got to have some effective strategy to be able to do that with. And you'll never be able to do it on your own. Well, let's put it this way. 1 out of 10 million might be able to do it on their own. I wasn't one of those 10 million. I had to have someone evaluate me and put me on a program and guide me through that situation. And although I'm not holding myself above anybody, because I don't feel that way about myself, I'm still, still pretty sharp. So, if you want to get it done, if you really want to get it done. And so, just taking a supplement, like, for example, eating soy, which is absolutely the worst possible thing you could do, because the sources of soy in this country are have their own level of additional side effects and risks, especially to thyroids.
Okay,
And if you have insomnia,
right there, Paul, hang
what?
on a sec. Hold that thought right there. Involving soy or regarding soy, we know
Yeah.
it's in many foods, many
Yes.
foods.
Yeah.
You've said repeatedly that soy is not good for us, but are some people who are dealing with these issues, hot flashes, night sweats, insomnia, are they seeking out soy as a treatment specifically?
Yes, it's touted that you can increase your estrogen. Again, following this theory of you're deficient in estrogen, it's why you have these symptoms. And soy is a plant source of improving the quantity of estrogen.
So
Of
let me
course, the
make sure
problem is,
I want to make sure I'm following you correctly.
sure,
So
sure.
there are those who are saying I'll have some soy and this will help me deal with my estrogen issues. Assumedly women are saying this, and then they find that they're not only failing to treat that issue, but they may be creating other problems because soy is just not good for them.
Well, that's number one, but soy is also an anti-goitrogen, which means that it adversely impacts the thyroid. And what did I say? One of the symptoms was directly related to the thyroid?
One of the symptoms directly related to the thyroid would be the hot flashes.
No,
Okay.
insomnia.
Well, I had a 33% chance of
You
being
did. You
correct.
had a
So
33% chance, and you were
and I
you
dropped
didn't.
the ball on that one.
No, you just. You only heard me say it like a couple of times. So
Well, actually, over the course of years, I've heard it probably hundreds of times. So
I
I
see.
could
Okay,
be
so you're a dunce, and you just didn't. You don't get it. Okay,
okay.
fine. I'll just.
I'll own that.
No, no, I'm not going.
I could be disingenuous, also. Who knows? Maybe I'm
Yeah,
I'm
that's
playing
right.
my part here
No, I don't think
in
so.
the show.
But
By the
anyway,
way,
so soy is has negative effects on a thyroid, which obviously is already having a problem because you're experiencing insomnia, difficulty getting to sleep or staying asleep.
are all these
And
things
so,
necessarily interrelated? If you have hot flashes, night sweats, will you also have insomnia necessarily?
no,
Or okay, so you could
no,
have any one of
you can
those
have
without
one
the
or,
others.
yeah, you can have one or all of the above. You could also have digestive concerns, some digestive problems.
And to be clear, Paul, are we talking about a specific demographic who are mostly dealing with these issues? Is it women, middle-aged women, for example, or is it broader than that?
Well, these three symptoms are often associated with postmenopausal, a postmenopausal condition.
Okay.
PMS is
All
what it's
right.
referred to. But you don't have to be experiencing PMS to experience one or more of those symptoms. I mean, in fact, it's absolutely not true at all that you need to be in the postmenopausal range to experience any of these symptoms. So it's a good question.
Well, and I think some women who are dealing with this may have a throw up their hands in the air attitude about it because they just think it's part of their aging process, and they'll accept whatever solutions may be available, like taking soy, or consuming soy in their diets, or as you said, taking various supplements.
Yeah, I mean, so remember in the beginning, of this particular episode, I said that I wanted to lay a little bit of the groundwork, and I did with respect to HRT, but I didn't with respect to the notion that just replacing estrogen or progesterone or both was actually, addressing the root cause issue. And the reason is, and now with a little more background, is that our bodies, up to this point, we've discovered at least 80 different hormones that the body utilizes in order to do one thing or another in terms of its processes. And it does so on its own without any assistance from us, right? The body itself is the manager and managee, as it were. And so why would you think replacing one hormone or two hormones in that situation would actually restore balance?
Well, because somebody you trust tells you that's the case. And you know what?
Exactly.
Well, but before you continue with that thought,
Yeah.
on paper, that doesn't sound unreasonable to me. If you're lacking in certain qualities or, certain needs for your body, and somebody says, well, just replace this hormone and then you will have everything you need. I don't know if I'm stating that as well as I could, but if you can follow that line of logic, it does seem logical to me.
No, it doesn't seem logical at all when you actually move to step two, which is if there's a deficiency of these two things and all of these hormones and the way the body functions as a whole, right? One thing affecting the other thing, affecting the other thing, affecting the other thing, right? To think that just replacing those two hormones would actually bring balance to the body absolutely overlooks the root cause aspects of a particular strategy.
Stated that way, yes, I see your point of view, Paul. So
Right.
again, as you've said repeatedly, you're treating symptoms, not causes.
Correct.
Okay.
And so what we really want to do, I mean, who amongst you that are listening right now knew, I'll get it right, knew that insomnia had anything to do with the state of your thyroid, the health of your thyroid, or that hot flashes had anything to do with the health of your bladder, or that night sweats had anything to do with the health of your heart? Who amongst you can honestly say you knew that? Not seeing any hands, right? So it's simpler. It's much more convenient to think, oh, I'm deficient estrogen, or I'm deficient, some other substance, even a vitamin or a mineral. And to think that you can just supplement that vitamin or mineral or hormone and restore balance to the body is, it's childish. It's just childish.
Well, fair enough. I don't think we should be too tough on those patients who accept that.
What I'm saying, when I'm saying childish, is that I'm not saying stupid. I'm saying uninformed,
Okay, fair enough. I think that's a better way to put
uneducated.
it.
And the point of this show is to educate. It's not to judge, not to castigate, not to, belittle. That's not my intent at all. But, I'm a pretty passionate guy, so sometimes I can, seem like I'm being harsh, but just understand the harshness comes from my heart. It doesn't come from, some self-congratulatory state.